Hi, welcome to the session. Today's topic is diabetes mellitus. Before we move on to the disease condition, let's discuss about the 5 key points of the diabetes mellitus. First is the pancreas. In pancreas, there are a cluster of endocrine cells which are known as islets of Langerhans. Islets of Langerhans are alpha and beta cells. The alpha cells is present in the periphery of the islet of Langerhans, while the beta cell is present in the center of the islet of Langerhans. Alpha cell produces glucagon, beta cell produces insulin and secretes it too. Second is the glucose. It is a form of sugar which fuels cells in the body with the help of the insulin. Third is the insulin, which is secreted by the beta cells of the islets of Langerhans. It attaches to glucose, which regulates the blood sugar. Fourth is the liver. It stores excess glucose as glycogen. Later, when body is in use, it secretes it. Fifth is the glucagon. Helps to increase blood glucose level when released. It causes the liver to release glycogen. Let's now see the definition of diabetes mellitus. So diabetes mellitus is a chronic metabolic disorder characterized by high blood sugar, which is glucose levels, resulting from body's inability to produce or use insulin effectively. Let's move on to the types of diabetic mellitus. First is type 1, that is insulin dependent diabetes mellitus. The onset is abrupt and it most probably gets developed in the childhood and it has the genetic factor involved in it. Second is the type 2, which is the gradual onset in the adulthood. That means few of the insulin is produced. It is resistant. We can say few insulin is produced. That means it is insulin resistant. It is most probably developed with obesity, poor diet and lifestyle. Next is the gestational diabetes mellitus, which develops during the pregnancy. During the pregnancy, the beta cells are unable to make enough insulin and it gradually goes after the birth of the baby. Now we'll see the treatment. In type 1, as we know, it is the none of the insulin is developed, so it is insulin developed. So we need to administer insulin to the patient. And in type 2, it is a combination of treatments. So you can go with diet plus exercise as well as oral diabetic medicines. Let's move to signs of diabetes. First is polydipsia, that is excessive thirst. Then polyuria, that is excessive urination because of the excess amount of drinking of water. Then there is urinary tract or yeast infections because of the presence of the glucose in the groin region. Then weight changes, vision changes, then patient can be tired. Because of excessive urination, patient also feels dehydration. Then low sex drive is there in the patients. Then changes in the periods is there. Then excessive hunger will be there for the patient. That is known as polyphagia. There is skin changes in the patient. You can see the blackish discoloration in the patients, which is known as arthrosis nigricans.